3. Healthcare facilities. Now let's discuss the two types of healthcare settings that you would commonly see. The first one are medical care settings. Now these are offices of health practitioners, nursing and residential facilities, home health services, and outpatient clinics. Clients that need diagnosis and treatment can find health care in these medical care settings. The next one is public health settings. These are usually community-based and may be voluntary organizations like the American Cancer Society. Now let's talk about the federally funded primary health centers and free clinics. Support and funding. Federally qualified health centers are supported by the HRSA within the HHS, and it is a private and public nonprofit healthcare organizations governed by a board. It is funded by Medicaid, Medicare, private insurance, and patient fees. Free medical clinics are nonprofit, community-based, or faith-based organizations. They receive little to no state or federal funds. Rather, it is supported by organizations or individuals with their fundraising events. They are staffed by volunteer health professionals. Target audience. The FQHC provides medical homes for medically underserved populations, like the homeless, veterans, and migrants. The National Health Service Corps assists in staffing primary care providers. Free medical clinics provide healthcare at little to no charge for low-income individuals, and in 2001, the National Association of Free and Charitable Clinics was established, and in 2019, 2 million people received healthcare at 1,400 facilities. Services. The FQHC provides everything, such as medical, prenatal, dental, pharmacy, and behavioral health services. They also address public health priorities, such as the opioid crisis and the HIV epidemic. Free medical clinics provide services less readily available elsewhere, such as free or low-cost medication and eyeglasses and health education. Location. Federally qualified health centers are usually staffed in a patient care medical home. Free medical clinics may be housed in temporary physical facilities. Barriers. Federally qualified health centers have supportive services like health education and language translation to reduce barriers to keeping scheduled appointments. Whereas for free medical clinics, barriers to healthcare access still existed for people who weren't eligible for government health insurance, such as the undocumented. Here is a brief summary. Federally qualified health centers provide medical health services to low-income, minority, homeless, and veteran individuals in underserved areas. They also receive funding from Medicare and Medicaid. National Health Service Corps also assists in staffing primary care providers. Free medical clinics provide discounted or free healthcare to low-income uninsured individuals. It is a nonprofit, community-based, or faith-based organization. Those who use free medical clinics are the uninsured, homeless, drug addicts, and immigrants.